So, welcome everyone to the Better Breathers Club of BC. We are talking about self-advocacy in our session today. Tina will be leading us through that. Just a reminder, our Better Breathers Club meetings are the second Wednesday of every month from now through till June. So we welcome you all. As we move through our session today, as I mentioned, feel free to share questions, comments. We are very open to that. I'm going to get our screen share up in just a moment here. We are so thankful to the BC Lung Foundation for funding our Better Breathers Club of BC. So thank you so much, BC Lung. All right, we would like to acknowledge the lands on which we work, live, and play as the unceded ancestral and traditional lands of the Coast Salish people. And for Tina and I, that's the Musqueam, Tsleil-Waututh, and Squamish Nation. So we are thankful to be learning and unlearning on these lands with you all today. We like to create a safe space in our Better Breathers Club. So do feel free to share your thoughts, your values, opinions, questions without fear of judgment. We thank you in advance for creating a safe space for everyone. Information shared here is for your education, and it does not substitute any professional medical advice that you've received from your healthcare provider. And without further ado, I will pass over to Tina to help us dive into self-advocacy.
Awesome. Thanks, Jenna. Well, welcome everybody. We're talking about self-advocacy today. So, how do you speak up for yourself in the healthcare system? And living with a chronic lung condition, we know how much you rely on the healthcare system and how much you have to work with the healthcare system, and how sometimes it can be overwhelming or confusing or frustrating. And our goal today is to give you some practical tools so that your voice is heard, and so that hopefully you can get the care to work better for you. So that's our goal today. And I'll just use a little story as an example, about self-advocacy. So it doesn't have to be, a big battle. It can be just simply saying what's important to you. So in this story, we have a patient, we'll say it's Martha, and Martha was prescribed an inhaler, a new inhaler. And after a few weeks of using this new inhaler, Martha's feeling exhausted and she's feeling shaky. She's really not having a good time of it. And she ends up having a doctor's appointment. And of course, the doctor assumes that everything is fine, and didn't have any plans to make any changes with her care. But when Martha speaks up and lets the doctor know about the side effects and about how that's impacting her life, the doctor is then able to make some changes, and suddenly Martha's life improves on a different inhaler. So it can be that simple, and if you think about this story, the physician is making assumptions that things are fine if they don't hear anything. Um, and sometimes healthcare workers are quite busy and they don't have time to check in. So they might not ask you how it's going. So it falls on you then, to sort of have a voice in your appointments to speak up so that you can get that change that you're looking for. Jenna, if you want to flip, what do I say? New slide. Um, yeah, and you know your body best. So this we can't impress upon you enough. And healthcare workers do know a lot. They've got a lot of theory, they've got a lot of knowledge and experience with different interventions or drugs and therapies, but you know your body best. And your lived experience is different than other people's lived experience and other people's bodies. So you are the expert. You are the one consistent thing in your care team. You're at all the meetings. So it's very important for you to tell them what you're experiencing. Whereas As healthcare workers, we just see people with little snapshots. We sort of come in for a little bit. We have that, shared time together, and then we go away and you go away, and it's kind of a little bit of a blank, and it's up to you to fill that in. So do think of yourself as the expert with your body and what symptoms you're having or what side effects you're experiencing. And I will say, trust yourself. Trust yourself when it comes to knowing your body. Um, and even just telling people, the side effects or problems that you're having, it doesn't mean they will find an answer or that is a big factor in the decisions of your therapy, but at least it can come into play if you say something. Next slide. We wanted to address conflicting information. That is certainly something we hear as healthcare practitioners. People reach out and they say, like I don't know what to do. I'm getting different information from my specialist compared to a different physician. People look online and get other information there. And as people receiving healthcare, you see so many different healthcare specialties in your care, and they all have a different lens. And so that experience leads them to offering different advice. And when it comes to finding therapies or interventions or medications for somebody, there's often not just one solution. There's not just one path forward. There's usually options. So there's going to be several paths that your care journey could take. And so it's about navigating that as best as you can with your care providers. So finding which path to take, and if you start on a path and it's not working out, knowing when to redirect and follow a different journey. So it's very important that if you're starting a new therapy or something changes in your body, that you tell people so that that can be considered in these complex decisions. And usually, too, we as humans don't just have one problem. Problems kind of come in sets. So we see that a lot, where a person has we call it a primary diagnosis. So they have one main thing that they're coming to see their health practitioner for. But usually there's a whole bunch of other things, and maybe that's not part of that visit, or maybe that's not why they're, involved in your care. But certainly those other things come into play when we consider making decisions about your care. So it can be conflicting and confusing. I certainly empathize with that, even in navigating my own care. So, yes, there's a lot of possibilities out there of what can be done to solve a problem. And I would try to think of it or frame it as a great thing. There are plenty of options. So if we try one, it's not the be all end all. We can try a different path. So think of it as though you have to find your path and you are the one that has to help navigate that. Next slide. So as we're trying to navigate these healthcare journeys that we're on, it's about making informed choices. So you've got to consider the benefits and the side effects. Most healthcare interventions, or whether that's a medication or a surgery or a therapy, most of them are going to have some kind of side effect or drawback. And so, or they carry a risk. Maybe you'll get fewer flare-ups with a medication, but it might make you more tired. And different people will make a different decision on that. So, maybe living with so much fatigue is beyond you. That's, I really don't want that. Maybe you'd rather have more flare-ups, even so you can live your life more energetically. And other people feel, I just can't have more flare-ups. Like my lungs are getting worse and worse with every flare-up. I know it makes me more tired, but that's a choice I'm making so that I can have less flare-ups, which make me really tired and sick. So there are benefits and side effects and risks, but again, keep in mind there are different options too. So just because one therapy is not going to be the path for you, maybe there's another option. And ask. This is a big thing, and we're going to come back to it too. Ask what's possible. Sometimes care providers feel that they know what the best path for you is, and that might very well be the case. But if something doesn't seem to be working out or it doesn't ring well with your values and beliefs, ask about other solutions. Just ask. So it's getting healthcare is an active process. And yes, there are decisions to be made, and you should be involved in making those decisions. So ask questions and then decide what fits your life and your personal goals the best. So decide what balance works best for your lifestyle and aligns with your beliefs as well. Next slide.
Sure.
Maybe
And
we'll
when
stop
some
for some. Oh, go ahead.
Yeah, we could stop the screen share. I was just gonna say, one simple thing along the lines Tina's talking to us about would be asking your healthcare provider why they're suggesting a certain decision so that you understand, their thought process of like what went behind this recommendation to see if that jives with you or not. So sometimes that's as simple as it may be, why are you suggesting this inhaler or why this therapy over this other one?
Yeah.
So just remember what of the W's, the five W's, remember the why. Yeah.
Yeah. Did
Any
anyone have
thoughts?
anything to comment there or before we keep pushing through? There'll be some time at the end too. I've tried to leave this presentation a little shorter so that we have time for stories and questions at the end. All right, let's push through. And Jenna, good segue. That's the next slide.
Okay, great. Can you see that okay? We
Yeah,
have Ken joining us. Hi, Ken.
I can. Welcome to it.
Oh, that was the
Okay.
next slide. Sorry,
Yeah,
sorry about
I know.
Hi there.
Hi, Ken.
Hello. Okay.
Hello.
How are you?
You've caught us mid-session here, but we were just taking a break to ask if there were any questions yet. So we'll push through and then we'll catch your comments and questions at the end.
Okay. Okay.
Good to see you.
Yes. Well, it's nice. Well, thank you. It's nice to see both of you as well. And sorry, I'm arriving as late as I am. The
Okay.
but I made it through.
You did.
Exactly. It's you know
Yeah.
what? Come when you can.
Okay. Okay. Will do.
Yeah. All right. So we're talking about advocating, self-advocacy, and we're suggesting you should ask why. If somebody's suggesting a therapy intervention or treatment and you're not sure why you're getting that treatment, we want you to understand why you're taking every medication that you're on. You should know why you're taking it. Or if you're having a procedure, you should know why. You should know what the benefits are that you're trying to achieve with that. And so this is part of, yeah, building trust, building clarity, building that relationship so that you and your care team can go forward together and make the best decisions for your life and for your care. So sometimes people make assumptions, right? We all have our own beliefs and values, including healthcare workers. And sometimes it's hard for a healthcare worker to separate their own beliefs and values. They know what they might do in a situation, so that would maybe lead them to making certain recommendations for their patients. And that might not drive with you. Those might not be your beliefs and values. So don't be afraid to ask why. And a good care provider will welcome your questions. A good care provider wants you to be involved in your care. It's not about dictating care, it's about working with somebody to find out what care they want to receive. Next slide. Personalize your message. So this is a great one. I love this point here. So care providers are busy. I'm sure you know. They're always on the clock. Your appointment is at a certain time, and then somebody else is coming a few minutes later, right? So they're on a certain pace, they're having a certain day. If you can personalize the time that they spend with you, um, personalizing things brings feeling. It allows people to care about you. The more they know about you, the more they will actually care about you because they know more about you. It makes you more relatable. It makes you more human. You don't want to be your disease. I used to hear more in healthcare discussions with other care providers. Oh, COPDers, IPFers, like these are the grouped people by their lung condition. And it does help in some sense, when you're learning about lung conditions as a new care provider and you're learning about different therapies. Yes, it helps to group people together by their disease so that you can, help to offer the right care and follow guidelines and whatnot. But when you're with somebody, it's not about the disease, it's about them. And if you share some personal information about yourself, it really helps the provider to put the focus on you and rather than your disease. And it gives them a little bit of light, sheds a little bit of light into what your life is like. And you might be surprised at how much that can influence the recommendations they make, or maybe they go out of their way to give you extra information or those free samples or whatever it is. So, so don't underestimate the power of connecting with somebody. And I'll give you a little example. So I do work in intensive care units an awful lot.
Ooh.
And well, yeah, different environment there. And it might be, you might think, how can somebody advocate for themselves in the intensive care unit? Because they're under in a horrible situation, of course. But the one thing that we do encourage and often provide some tools for that is to personalize the person who's in the intensive care unit by putting up pictures of them. So, if you're the family, you can put up pictures. People make little storyboards or like a collage, pictures of their family, whether it's a little, a grandkid or whatnot, or pictures of them, going for a walk in the woods or doing something, living, something that's their passion, their hobby. And it does make a difference. There's days where, we're working and we're busy and you're doing your work, but if you look over and you see, a family and somebody who's quite vibrant and alive, it's very different than what you see when you look at somebody who is so sick that they're in the intensive care unit with all the lines and tubes. At the end of the day, we all end up kind of looking the same when we're in the intensive care unit. I gotta say, um, people look like a patient. And if you can rehumanize that, it does make a difference. It also helps the healthcare workers feel that they're doing something worthwhile because after all, it's a caring profession. People come into healthcare as workers to help people. And so if they can see the person that they're helping, it really does make a difference. So you have the power to do that, even if it's just sharing a funny story about something you saw on your way to the appointment, or something funny happened at home, or oh my God, I had the best chocolate cake last night. You know, just something personal really helps. So I encourage you to do that. I know the appointments are short and rushed. It doesn't have to be a long story so that they get to know your high school classmates, but a little information goes a long way. Next slide. All right, let's talk about some ways that you can advocate effectively. So, when you are talking with a healthcare provider, you do need to say what you want. You need to communicate what's important to you. So it doesn't have to take a long time. You can plan it out. You can take notes before you go to an appointment and be ready with what you want to say because we all know we get to that appointment and, oh, I forgot to ask about whatever, this main thing that you were totally going to ask about. I know you forget when you get there. I do it all the time. So take notes, have a plan when you go in. Find out, write down those why questions. I want to know why, blah, blah, right? Why did we test me for that? Why did we do blood work? Like, what was that for? So ask, be clear and concise. Think about it. That takes a little bit of commitment on your part or preparation on your part. Think about what you want to know or what you want to say. And if you write it out, hopefully you're able to do so in a way that is clear and concise. So you don't want any misunderstandings about what you're saying or about what's important to you. So focus, and then this is the next point, focus on your goals and priorities. So be clear about what your goals are, communicate it, and then motivate them to care for you. So motivating people to care for you is usually about explaining how something has impacted your life. So even if it's as much as saying, hey, I got started on this new medication and I feel horrible. I can't pinpoint what it is. Maybe I can't list specific symptoms, but I know I feel horrible on this. And then they might start asking you some questions to help clarify what the problems are. But do motivate them to care for you. It does lead to better care. And work with them as your team. So if you can see your care provider as your partner in care, as opposed to like, I'm going to them to see what they're going to tell me, as opposed to, hey, I'm going there to work with this person to make decisions about what we're going to do next. And oh, sorry. It goes a long way to just ask, sometimes just ask. So maybe you don't know what the solution is. Maybe you do. Just ask, hey, is this the right thing? Is this the thing I should be doing? How come you didn't recommend this? My friend had that, and that's what they were provided. So just ask. Just ask. Next slide. Ooh, doctors on a pedestal. I wanted to put this slide in there. So, in society over time, we come across, um, I don't know. How do I put this in a good way? Some people believe that the doctor knows everything and they know best. So if the doctor told me to do this, I should do it. It's not a bad way to look at it in terms of, following instructions and whatnot. But physicians are trained experts. They have specialties. Some of them are generalists, but some of them are very specific knowledge and practice. So they don't know everything about everything. And they're also the gatekeepers to other healthcare resources. So it's important to understand sort of the role that each of your caregivers provides. And in healthcare, we're working more and more towards this team approach, a team-based approach, and we're working more towards holistic care that focuses on the person. And I feel that that's a change that's happened with healthcare over time, and I feel it's heading in a good direction, and you can help that too. So you know the most about your body. So if you're having pain, people don't know that. A healthcare worker won't know that you're having pain unless you tell them. And it can be difficult to explain how much pain you're having or how much impact on your daily life that pain or discomfort or whatever it is having. And so it's up to you to personalize that and share that with them. So let's say, they'll usually ask you your pain on a score from 0 or 1 to 10. and maybe your pain is at like a 3. So they're like, okay, it's a 3. It's not that bad. We can give them, a pretty minor medication that'll take care of it. But if your pain's at a 3 and it's stopping you from doing things that are important to you, then that's a different story. This is disabling you. Even though it's a pain of 3, maybe it's in a body part that you really need to use for your life, right? So explain to them and know that there's a lot of value in what you bring to your care. You are, after all, the most important person in your care. So don't assume that they know things. They can't look at you and see the pain. They don't know that. So it's important that you are involved and that you recognize the value of your opinion and your input. Next slide. All right, key takeaways. A little recap before we get into our discussion here. So you know your body best for sure. I hope I really drove that home. Your opinion really does matter, and you should be involved in your care decisions. Ask questions, especially why. We want you to understand why everything is happening in your care. And weigh the options. There's usually a bunch of options, and choose what works best for you because you are the most important person in the picture here. And share your personal story. Get providers on your side. It's a care team, and you are one of the team members, the most important one. Maybe we'll stop there, actually. Yeah. Awesome. So I would like to open the floor for discussion. Um, because this is where the meat meat of the matter is. And I feel like with self-advocacy, people do have stories, whether they're good outcomes or not. We would like to hear them. Or if you have questions about a situation, maybe we can all brainstorm it together if you're having trouble navigating something.
Does anyone have a positive story where you sort of felt like, ah, yes, I did the thing. I was afraid or I wasn't sure, but I talked it through or I pushed a little harder to get the answers I needed, and that felt really good. Anyone had that situation?
Well, recently, a few months ago, I did. My name is Ken. I had a double lung transplant about 3 years ago, and and the uh, getting it. There are many things that happen with a double lung transplant. You think, or at least my initial perception was, well, I'll just charge ahead after I get a double lung transplant, and I guess the first year afterwards, I saw significant sort of gains, but then I had significant setbacks, which anyone who I think most people who've had the operation usually have something going on over the period of time. And but recently, recently, I guess a key to this particular story is that I now have significant kidney failure.
Oh,
When I say significant, I mean fourth stage, sort of, where my GFR. For those who know, my GFR was hovering around 12, and this stuff was caused by some of the drugs some of the base drugs that they have you on for anti-rejection, and and so you can't remove those drugs. But anyways, there was a fair bit of going back and forth with the lung transplant team on what and with my nephrologist on how best I could we could manage things going forward. And the lung transplant team wanted to, and so what happened? I had this major setback. I really thought I was about to die. I had so much backup of fluid because my kidneys couldn't process it into my lungs and heart that quite significant, very life-threatening and things like that. The fluid was, but we managed parts of it okay. And then the lung transplant, and I was sort of building and getting better. And then in the middle of that, after about, let's say 2 months after the major setback with my kidneys, the transplant team wanted to change over my medication routine off one particular style into another particular style. And I won't get into all the details here. I will say that they want to take me off sirolimus and put me on something else. And so but I also thought, like
That's a big change.
big change. Well, there's a number of other things. Finally, I was starting to get into a stable position. I had in my I had issues going on with my GI tract that I've had ever since the operation, that I had just got stabilized a few months before this.
But we'll see you
Oh,
later, Barb.
Barb just left.
And so but anyways, the long and short of it is that they wanted to put me on new medication. I said, no, I don't want to go on this medication. It's not what I want to do. It's and so we maintained it and went ahead. And there's ever a thing about talking back to medical professionals, but I do think it's important. I mean, I don't know the full scope of what the changes would be. What I did know is that it would be unstable. And one of the major concerns I had is that by coming off sirolimus, it would affect my resistance to skin cancer, of which I've had 4 or 5 outbreaks of skin cancer over the last year. And my dermatologist was saying, thank goodness you're on sirolimus, because if you weren't on that,
Right.
I don't know how we'd be able to manage this stuff. So
Yeah.
anyways, long and short of it, that's where it came. That's what happened.
Thanks so much, Ken. Yeah. So it sounds like you had many different teams you were working with some conflicting information, and you kind of had to take that all in, make your decision, and then communicate that back, which was sort of opposite of what the transplant team wanted to do. So that's great. It's hard to do to make a decision like that. Yeah.
Yeah, and I noticed too, you frame that as, talking back, right? So they had kind of put down a decision there, and you probably felt like I'm standing up against them, it can be quite a thing to do.
Well, true enough. I mean, I don't want to resist treatment just for the sake of resisting treatment, but I
That's
do.
fair.
I
Yeah.
also, they hadn't considered maybe uh, the skin cancer thing as much as I had, but having 4 outbreaks and 3 major operations, sort of dealing with the skin cancer over a period of 5 months. Was quite enough for me to say, no, I don't want to. I don't want this risk of being brought into my life, aside from the other effects of stability.
Yeah. Yeah, that's fair. I think you make a very good case for your decision, and I stand by your decision. Knowing what you've told me there, the way you frame that, I feel like you made the best decision for you. Yeah.
Mm.
I'll just, Barb had to leave a bit early, but she's written a comment here, so I'll just read it out. So she just said, prior to leaving, I just want to say I agree wholeheartedly that we need to be our own advocate. Healthcare professionals are stretched so thin right now. They need all the support that they can get from us to help us with the best in our own healthcare. So thank you, Barb.
Ah, she's so wise. It's true. It's true. And, I think we all feel that the strains on the healthcare system. we try to navigate it as best as we can. We have to work with it and work with those people and those short interactions that you have with your care professionals that make a big difference in your life. You know, you want to maximize that. You want to make it the best, you know, efficient, most valuable use of your time. And you want to make sure that what's on the agenda is in keeping with what you want and communicating that. Yeah. So good. It's true. It's yeah, personalizing it is so important. I do run into so many different types of people and families in healthcare. And I'm always so supportive of people who are asking those questions. And I see both sides. You know, I see the healthcare providers like, oh, they have so many questions, or are they challenging me, or whatever, you know. And I'm just thinking, yep, they're doing the thing. They need to do that, you know, because I see the opposite too, where there's more of a passive approach, you know, just, oh, they're doing this, they're doing that. And if it's working out for you, that's fine too. You know, if you feel you're just happen to be getting the best care, which happens a lot, that's fabulous. So what we're talking about here are those times where you're not sure if you're getting the best care or you feel like you're not getting the best care. So it's good to approach it as a team approach. Often the care providers don't realize that they're making decisions that have negatively impacted you. The goal is always to improve your health, you know, or support you through some health crisis. So I think if you approach the care provider knowing that that's why they got into this job and that they want to help you, um, you can work together and go forward. But it's important that you feel heard. And I know that some care providers give off less of a vibe of hearing you. So, you know, even in our public healthcare system, there is sometimes room for you to choose a provider where you can. And if you really feel that you're not getting proper care, at least say something, bring it up, bring it up. Yeah.
Mm.
Health authorities do have they call them all something different, but like a quality health team, some team that you can report back to if you've had an issue in your care. Um, and I did do that actually in a situation in my care. And it was like a certain step I felt that was missing with the procedure I had to have that impacted me. And I voiced that. And and the nurse gave me the number. She's like, you should do this. And I called because you know, in those situations you're like, oh, do I just put this under the rug and move on?
Yep.
You know, so you do have that internal struggle a bit, but I did call because I just thought to myself, you know, I don't want anyone else going through this. Um, and I called the team and yeah, action was taken. I was told, you know, anyways, that they made a change to their procedures, so
Nice.
that this could be caught for other people. It was had to do with having a surgery. Yeah. So yeah. So
Yeah.
they're often called a patient quality, like a quality team.
Yeah.
Mm.
Nice. Nice. Nice work, Jenna.
Yes.
Yeah. Nice work, Ken. Anybody else have a story they wanted to share? Or if you're going through anything now, just brainstorming things?
Yeah, I just wanted to you mentioned like knowing your own body, so I thought I'd share some of my experience with my asthma.
Mm.
So like for the longest time, I thought like being out of breath and having to take my rescue inhaler a lot was like status quo, right? Like it was like the normal, like this is what asthma is like. And you know, like I'd had a doctor when I was living in Ontario that was like, "Oh, your asthma is well controlled, so you'll be fine." Like during COVID, I wasn't fine during COVID, but like I never actually expressed like what was happening and like how often I had to use my inhaler. So it turned out it wasn't fine. Like I didn't end up in the hospital or anything, but I think COVID had an impact on my lung health. So it wasn't until I moved to BC that I was like, maybe this isn't like what it should be, and I should start like advocating for myself and trying to find something that works better, right? And so, yeah, anyway, so I started the journey. I came to one of your talks, and then I started talking to my doctor about it a bit more. And then I eventually got to a respirologist, and he prescribed some new medications. It seemed to work in the fall, like last year in the fall. I was actually my asthma responded really well. But then this spring was like terrible. Like I have like really bad allergies from pollen. So yeah, it was really bad. And then I kind of got into that mind frame again. It's like, oh, this is just the status quo. At least it's not as bad as it was. Right. So I
Yeah.
never really raised it until like, I think July. I was like, okay, this is really bad. Like I need to start at least writing down how often I take my puffers. And so I have like stacks of post-it notes with like how often I took my puffer.
Yeah.
And then I kind of like, I waited until I saw my respirologist, which I shouldn't have done. He even said, it's like, just call me. Like, that's my job. So anyway, but it was just like that same pattern, right? Like that status quo kind of pattern. Anyway, so I took my asthma action plan and I wrote down a couple examples of like when I was really bad. Because I thought like, maybe I'm in the yellow, and like, when's the yellow move over to red? I was in the red like several times in like spring and summer. So anyway, I brought that to him yesterday actually. and yeah, again, like he was like, yeah, you should have called me earlier. It's like, we need to move to like a biologic and like get your blood tests, get things going right for you. So so that was really good. But yeah, I'm just saying, like, being aware, yeah, the doctor didn't know how my asthma was, right? Like in Ontario, and I kind of expressed myself a bit in the fall when I saw my respirologist, but maybe not as much as I probably could have, right? Because it's that status quo type. It's actually called status quo bias. So it's the status quo bias that kept coming in
Yeah.
on me, right? So yeah, so now I just kind of finally realized that I need to kind of advocate for myself more.
Good
And
for
it's
you.
not a status thing. Like taking my
Yeah.
Symbicort like 4 times in a row is probably not good, right?
It's
So like,
Yeah.
yeah, so I need to get a different treatment. But yeah.
yeah. Such a good story. There's so many things to draw from that too. And as humans, we are pretty good at putting up with stuff,
Mm.
you
I
know?
was about to say, I'm completely generalizing in this statement, but I just feel like those of us that live with chronic lung conditions, we're the grin and bear it kind of type. Like, we're not used to like being the ones, but I
Complainer.
think
You feel
this
like, oh,
talk
am
is
I just
really
a complainer?
yeah, hopefully this talk is really motivating us as a team, as a support group to do what Corey said and bring these issues to the forefront. And yeah, and part of that is getting informed. So Corey doing the work to know that like, hey, taking my rescue inhaler so much is not good for, and yeah.
Yeah, there's so many good things you can pull from that. That was such a great example. And I appreciate the respirologist response too, right? Had you
Yeah.
called earlier, it would have been perceived as like, yeah, I'm here to help you, right? Yeah. Yeah, we really, some people will report things. Some people are so good at it. If something's bothering them, they let people know and they find the solutions. And others of us, I'm lumping myself into your same category, Corey. I'm fine. I wasn't using that leg anyway. I'm a good hopper, like when it comes to our breathing, especially. You've got to get it fixed because when your lungs are angry, like yours would have been in the yellow and especially in the red zone, the sooner you get it fixed, the less damage that's going to happen over time, too. So we're not really doing ourselves any favors by grinning and bearing it either.
Yeah, and that's one of the reasons why my asthma is so bad, is because I did that, right? I was undiagnosed when I was a child, so that's one of the things. I found that out talking to my respirologist, and then I kept like kind of just gritting and bearing it, like accepting that that's the status quo of my asthma, and so now it's like really bad to the point where I need like even more intervention, right? So yeah, it's difficult.
Hey,
Well,
hey,
life will
can
work.
I say something?
Yeah, man, go for it.
No, I was really, I like the example that Corey has just told us, because this is very typical, not typical, but commonly happening to a lot of asthmatic patients, that this is my life because I'm asthmatic and I've had this, and this is where I would live up to my last breath. And that is, and you're proven to be wrong on that one. And which is nice, recognizing the fact that should not be my way of life for the rest of my life. And good thing that you realize that you need to go to your healthcare provider, ask for more help, and sure enough, your respirologist realized that your medications are not work current medication at that time are not working, and therefore he evaluated you back, and then it's just like you need something else. And this is what we're trying to emphasize to most patients, not because you have COPD that this is the way of life. You could still have a good quality of life if your symptoms are well controlled. And that has been the emphasis of all these educational activities that we're doing for patients with asthma or COPD. So realize that if you think that this is not normal, especially, I know this is commonly happening for people who migrates from one place to another. There is a good valid explanation for you're feeling better in the first 3 months of in your new place, and then all of a sudden there's a sudden flares of your symptoms. It's because you are now sensitized to newer sets of allergens, or what do you call this, triggers. And that's why you started having symptoms again, or even worsening of your symptoms. But I do want to acknowledge your wise decision to go back to your doctor and ask your doctor, and this has been emphasized by Tina during her talk. Always ask, and always don't be afraid to ask. However, I know that there is such a limitation, because I just found out, I just had my doctor's appointment, and I was told that I only have 10 minutes with my doctor. And
Yeah.
I said, oh my God, how could I summarize everything I want to know in 10 minutes and ask my doctor about everything I want to ask in 10 minutes?
Yeah.
So again, we are so limited with doctor's timing, or even with your healthcare provider. So make sure you have your list of questions before coming into, so that then once they see your list and you start reading it, your doctor cannot just say, you feel better, okay, go. No, because they will pay attention to those lists of questions, to that list of questions.
Yeah. I as you say that, Men, I'm putting a link to our um, latest blog, which we go through some practical tips, especially for
Mhm.
appointments, in terms of self-advocacy and navigating healthcare. And so in that 10 minutes, maybe this blog article might help you to um, figure out or write down, okay, this is my issue. And our blog article encourages you to do the follow-ups. So if a follow-up has not been provided for you, to be proactive and call and get your follow-up, so that you can either continue the conversation or move on to the next topic you needed to discuss.
Mhm.
So I just posted that. And I'll just do a little time check here, and we are at 3:03, so I'm just going to bring up the last part of our presentation here. And while I do that, I just wanted to offer just one last comment on Corey's story, which is that, for our chronic lung conditions that ebb and wane and have peaks and valleys, um, sometimes escalating care for sure feels scary. It feels like, oh, my lungs are getting worse. But sometimes, especially with asthma, escalating care, especially when it comes to biologic, you know, can offer that quality of life. So if they hit the right biologic with you, and Corey, they're going to work with you to try and find the right one. You know, many people respond so good, so well. Their asthma gets so controlled. And as we move through living with our lung condition, you know, the options and the medications are just getting so much more specific to your specific inflammatory cells or your specific you know, way that fibrosis is happening, you know, and so the care is getting like really kind of precision, which is kind of nice too. So even though it feels scary, escalating care can be positive if you're able to really get the right one to get you controlled and quality of life back. So thank you so much, everyone, for sharing today. If you're looking for more, just a couple of reminders of some programs we have coming up. So we have our pulmonary rehabilitation program. It's a continual program, an exercise and education program. We consider this to be our foundational breathing course. So reach out to us if you have not taken a program before. We highly recommend it. And our Harmonicas for Health and Happiness is restarting this fall. We are doing intake sessions. So if you haven't taken our program, please call us or email us to get on the wait list. And if you have taken our program, happy news. We will be starting up a monthly meetup, an alumni group for all of our Harmonica participants so that we can gather monthly, continue to play together and learn new songs. So call or email us for more information on that. And if you've enjoyed this, we have another session coming up next month. We're going to have an occupational therapist talk to us about energy conservation and reducing our risks for falls. And if you've been enjoying our services, you know, we are a new and up and coming company. So if you're able to, it helps us to leave a review on Google. We really, really appreciate it.